All right, there's a lot of questions in the chat for you, Shivani. Our officers, I'll just start like pulling them up and just saying them out loud.
Alrighty, so one question we have in the chat from Nicholas O is there something that made you have second thoughts about working as a healthcare administrator?
Yes, actually, that's a really good question. So I told you guys how I worked in supply chain. I absolutely hated it. Like at my 1 year, I'll be honest, I really, really didn't like it. That 1 year I worked, but it almost made me change my mind because I just didn't like it. But then but then when I realized that, I was a very good friends with one of the managers at the hospital, and she's amazing, like super powerful woman, worked really hard her entire life, and is now a director of cardiology. So I expressed this concern to her. I was like, I'm about to go to a master's in this, but I really didn't like my job as much. And she goes, okay. So she basically gave me that whole clinical side that I was missing doing supply chain. She gave me that whole view of like ER, ICU. I'm like, this is what you can do as an administrator. You can have an office in the ER, in the ICU. You're on it 101. And she gave me the opportunity to just like sit with her for a week and do my work from that office. And that made me secure about what I wanted, because sometimes you're going to have experiences that you're not going to always like, but they're going to teach you a lot. Just because I didn't like what I did job wise didn't mean it taught me a lot. But yeah, that was the one part I almost kind of switched, but then I stuck my ground.
Another question is, what do you specifically do at a residency?
Yeah, so residencies are super cool. It depends. So I'll give you guys an example. So I have a friend at Stanford doing her residency right now in project management. So what that is say Stanford, you guys can know they have little clinics throughout the Bay Area. So with these little clinics, you need a team to figure out like, okay, location, what's the demographic of the population around there? Are people going to come to this clinic? How many offices do we have? How many clinicians do we need? What equipment do we need? What team do we need? So her job, she's right now on a project where they're trying to expand the Stanford clinics in the Bay Area to I think about 3 more. So she's on that team where they're figuring out those things, and it's really fun, even to the point where she's like, dude, I'm even doing interior design. I'm trying to figure out what colors match the walls and what will look nice, to back to clinicians, like what things are they going to need? What are patients going to need to feel welcome? So that's an example of a residency in project management, but you also have quality of care. So you can do like, I want to improve patient care. So you can do a residency in doing that. So you could be surveying patients as the initial step and then implementing those changes patients would look forward to. So or you could do a residency in finance at Kaiser is big on doing residencies in finance. So they're just going to teach you the ropes of finance in hospitals and budgeting and how much money is really required to run certain systems. So each residency changes. It depends.
Another question we have is, which schools are good for undergrad for healthcare administration? Like, which ones would you recommend or think are good?
So I'm not going to single out any schools, but I will say that just because I said there's so much you guys can do undergrad before going into it, but any school that offers a public health major. So with me going to Riverside, they did not have public health. However, they were huge on their free clinic. And Riverside Free Clinic is state known for being one of the best free clinics in California, but also in the US. So I had that advantage. So you have to really look at what the school offers opportunity-wise. We have a medical school. I feel like any college that has a medical school or a hospital system or associated of some sort where you can actually go and do things on your free time, that's the best. So it doesn't have to be a huge name school. I know a lot of you guys are maybe at that time right now where you're like, oh, like I only want to go to UC Berkeley or UCLA. I'll be honest with you, your college experience is what you make of it. And it's also dependent on what's around your college and what's there. And I would definitely just look at what has your major. Yeah, public health maybe, and just resources.
First and the best thing that happened to you in high school, college, right now, and what was the biggest obstacle you had to come to where you are now?
Do you mind repeating that question? It kind of like fizzled out. I couldn't hear you.
Yep. So, what was the best thing and the worst thing that you experienced in high school, college, and right now? And what was the biggest obstacle you had to face to be where you are now?
Okay. Best thing in high school, like I said, was having I had a really good group of friends. I think that's also pretty important. I had very driven friends. Some of them are on this call right now, but they were amazing. Your friends, I think one of the best things in high school, yes, Mr. Vasquez physio was awesome. I will tell you that Mr. Vasquez's class was probably, no, it was like Mr. Vasquez's physio class and Mr. Kreger's biotech class were my two favorite classes I ever took in high school. So best things honestly were my teachers and my friends, who honestly all motivated each other. When you have a support system, I think it's great, and that carried on to me in undergrad. I also made a great support system of good friends who are also willing to do the same things, or like in their respective careers they were just as driven, just as excited, just as motivated. So that's honestly one thing I will recommend to you guys. You don't have to have a huge circle, but even having one or two people around you that are going to motivate you, and be, that was one of the best things that carried on to me for both. Worst things, again, were just certain classes I took that I felt were extremely unnecessary. Not in high school, but I would say in college. There are going to be classes you guys are going to take and you're going to be like, why am I taking this? But they're required for your major. So sometimes you might not like something, but you have to do it, get through it. So those were the only obstacles. And again, just really knowing what you want to do, like deciding healthcare admin. No one in my family besides my aunt's healthcare admin, no one on the West Coast. So my parents were also new to it. They're like, what is this? What are you doing? So it's kind of like doing your research. That was also an obstacle. Like doing your research is really important, and trying to go out there and talk to people. But yeah, those are ups and downs, I'd say.
We have another question in the chat. If you minored in business, would you kind of be more competitive?
So competitive going into masters, or just like in that respect, correct? Like going into masters?
Yes.
Yeah, it depends. So if I did, like, for example, if I did a clinical major, like biology, right? And then I minored in business, I would say that's a very beautiful resume for you going into one of these healthcare administration fields, because it shows you that you're clinically involved, but you're also business involved. However, I don't recommend it. I think that I know business is great as a minor, but you have to make sure you can handle it. In undergrad, especially, I was at a UC, it's very, you're studying a lot and you have to know what you're handling. And I think it's better that you give yourself a little time for yourself as well, and to join other clubs and extracurriculars. It does make you competitive. I won't say it doesn't, but if you did a nice business major, if you wanted to, and then have done a clinical work, or vice versa, a clinical major and done a ton of business work on the side, that's, for me, I think that's just as competitive. It's all on your experiences in this field. Like, experience is like everything.
Excuse me if I'm saying this incorrectly. Simran asked, was student life difficult to juggle with your undergrad, and do you think your social life is more balanced now, or was it more balanced earlier on?
Okay, so I will say, undergrad, like, now just think, you guys are in high school right now. It's a different realm. Well, the second you get there, you have no parents asking you what to do. You're not in any sort, you're free. You're a free bird once you're there. You have no responsibilities, especially as a freshman. Like, you're getting food made for you. You're like not doing anything besides your own laundry. So the time you actually have on the side is pretty large. And for me, though, my situation was a little different. So I decided to join a national competing dance team. And those things, whether you're doing dance, sports, cheerleading, whatever you're doing at your undergrad, you're gonna get super involved. So like for me, I had practice 18 hours a week on top of me studying full time. So in the beginning, I was overwhelmed, but I also had my friends in all these things. So the friends I made, they were also in my classes. The friends were also in my dance team, a lot of them. So it's all about time management. It's about really, truly gauging what you need. And I don't think my social life deteriorated. If anything, in college, it kind of got excessive. It got a lot. So it became to making sure that your studying was prioritized. So the days became long, but the memories became, I think, even better. So my whole thing is, if you can have the whole cake and eat it too, as long as no one's getting hurt, as long as you're getting your work done and you're nice and kind and humble, you will be fine. Like, as long as you practice those things.
What would you say is like a good age to start interning or where should you start interning first if you want to go into healthcare administration?
Yes, so if you're going on, so I mentioned a lot about hospital, but there's also healthcare consulting. So if it depends in healthcare consulting, I'm sure you guys know Deloitte in San Francisco. We have Deloitte over there, or like EY or these companies. So it depends on what you want to do. But if you're going to hospital admin, at least for me, it really helped just shadowing. Like don't even not doing anything, by just talking to people and watching people. I think it's important to listen and observe. And once you learn how to do that, that's the first step in my opinion. Because if you're just trying to know, you don't need to tackle an entire 3-month internship. Because for me, I just went for 2 weeks just to know. And the second I saw it for myself and I figured it out that like, oh, this is cool, that's when I started to look into higher internships. And that's when I started to look into bigger things. So I think stepping in the beginning, for sure, just go email people. When I was in undergrad, I emailed so many healthcare executives. No one really got back to me, but you have to keep trying. And the second you keep trying and just one person is like, yeah, you can come shadow me for a day, that'll be a very good experience in my opinion.
Nathaniel Ye asks, since healthcare is such a huge field, how did you decide that you wanted to go down the healthcare administration side instead of being a doctor or nurse?
Yeah, again, with the doctor, the way I view it, I think you need to be a very special type of person to be a doctor, in the sense that you have to study a lot of years in school, you have to be very patient, you have to really know your stuff, and I think all that is extremely awesome and incredible, and we can't live in this world without doctors, for sure. However, the doctors, their mind is so focused so much on clinical things because they have to remember those things. It's a big job. You're talking to someone about their life, their health. It's a very, very big job. But they don't have the time to sit there and think, how do I make this more efficient? How can I see more patients and help more people? And for me, like when you choose a career in your life, right? Like that's what you like to do. That's your passion. However, for me, my purpose is, my opinion in life is to help, and I want to give back, and that's all I want to do. So I was looking for a career that not only for me helped one patient at a time, I wanted to figure out how to help thousands of patients at a time. So when you're a healthcare administrator and you're working in the clinical aspect of things, you do so many things, from making things more efficient, like having patients in for 7-8 minutes or 15 minutes, but depending on your hospital system, but seeing more patients come in, or going into just changing hospital equipment. Like we cannot be using things from like 1995 anymore, right? Like it's like trying to make sure things are upgraded, because the quality of care you give your patient is number one. And I think a lot of people forget that in this field. Even sometimes clinicians and for sure healthcare administrators forget this, that your patient is not a customer. They are a person, they're an individual. And so when you have a healthcare admin that have this mindset, I think it'll make a fat difference in American healthcare. So that's the reason I wanted to go into it, and hopefully do more than just hospital director one day. I'd like to get into policy eventually. But yeah, I wanted to make a large scale change more so.
That was very meaningful and inspiring. But another question I personally have is, given our current circumstances, like the ongoing pandemic and the uncertainty around the stay-at-home orders and whatnot, what financial advice do you have for high school students looking to enter not only healthcare administration, but the medical field in general?
So financial advice, like wait, can you elaborate on that just a little bit more? Like not going out and spending money, or
just steps we can take as high school students before entering college.
Oh, like jobs and stuff like that. Okay, so for me personally, again, you guys have to be careful, first of all, right? That's the biggest thing. It's a pandemic. We all, I'm sure, know someone or have someone at home that's immunocompromised. So first of all, just make sure you guys are careful. We are in that age range where we could be asymptomatic and not know. So whatever you want to do, I just advise everything is careful. I definitely think I know a lot of people are hiring right now virtually to do things from home. If you guys can find something that is working with your schedule part-time, then I would for sure advise it, because it's going to teach you discipline. It's going to teach you time management. And I think in undergrad and in your career, time management is going to be a very big thing. So I definitely recommend working here and there. Like I definitely worked for a year. It taught me, even in high school at the end, I worked. So it taught me discipline for sure. So if you can, while being safe, I do recommend it. Yeah.